All right, there's way too many people out there not getting the benefits they paid for, entitled to, need in retirement, particularly over 65 years old. Hopefully that's not you, but there just might be someone around you that you know, love, care for, that just might be doing the wrong thing. So we're going to talk about all that today. Looks like I've already got a bunch of questions as well on all things Social Security. So if you're here live, make sure you type them in the chat. If you're here watching this in a recording later, make sure you type them in the comments. And I've also got a few video questions that people sent in. So if you've got a particular question or comment, someone left a comment about how long they were waiting on Social Security to get into the phones. So we'll play those later on. But okay, so let's talk about what you can do and what you can do after the age of 65. All right, so number one, 65 is not that big of a deal for Social Security anymore. In the early 1980s, Congress, they changed the full retirement age from 65. It was 65 since 1935 when they started Social Security. It used to be 65, and now it's no longer 65 years old for full retirement age. Now, for people born 1960 and after, it is 67 years old. And there's some talk about their increasing that again to 69 or 70 or whatever the case may be. I've got a little video I'll show you that some business type of reporters want it to be increased because they don't want their compatriots, their billionaire buddies, to pay the the FICA tax like we do. But anyway, I'll get into all of that a little bit later. All right, so one thing that is important for those people that are 65 years old is Medicare. So Medicare hasn't changed. It's 65 years old for Medicare. Obviously, if you're receiving disability benefits, then you get Medicare after being on disability, Social Security disability insurance after 2 years. Okay, but in terms of Social Security, retirement spouse benefits, surviving spouse benefits, and all that kind of stuff, not a big age, 65. 60, 62, 67 are bigger years. But all right, so let's get into the Medicare part of this. When you turn 65 years old, you kind of have to make a decision. Is Medicare mandatory at 65? Well, as we used to say in the Marine Corps, nothing in life is mandatory, but the repercussions are X, Y, and Z, right? Push-ups or whatever the case may be. So for Medicare, if you do not have health insurance from work, current work, yours or your spouse's current work, and that employer has to have 20 or more employees. If you have that, insurance from current work, yours or your spouse's, 20 or more employees, then you have what's called creditable coverage, and you do not need to sign up for Medicare. Too many people are signing up for Medicare because they think, I thought it was mandatory. I thought I had to sign up for Medicare at 65, and they're basically throwing away $185 every month. They're talking about it maybe going to $200 or so next year, but we haven't got the final numbers yet. But why throw away $185 every single month, $2,000 a year basically, for something you don't need? Okay, so it's not mandatory if you have creditable coverage. Some people, if they have health insurance from work, they go ahead and get Medicare, particularly Part A, or maybe Part A and Part B, because even if you have health insurance from work, you're not mandated to take Medicare. Maybe Medicare Part A, Part B with a Medicare supplement, a Plan N or a Plan G or whatever the case may be. It might be better than what your employer provides. Maybe it's cheaper, covers more, something like that. And maybe you just want to sign up for Part A. So don't sign up for Part B if you have that creditable coverage. You don't sign up for Part B. You just sign up for Part A, which is zero premium for most people. And then a lot of people find that covers more if they get into a hospital. So some people go ahead and sign up for that. Okay, so you can sign up for Part A alone and say, don't start my money because I'm working. I don't start my B because I have health insurance from work. I just want A. You can do that. No problem whatsoever. If you don't have creditable coverage, then yes, then you should really sign up for Medicare Part A, Part B, and then you'll need to find some type of plan to cover all the gaps. There's a lot of gaps in original Medicare. The big one is Part B has a 20% co-insurance. That means if you get a $100,000 Band-Aid from your doctor, you got to cough up $20,000. So if you are receiving benefits from Social Security and you're approaching your 65th birthday, Medicare will send you your package automatically, and they will sign you up automatically for Part A, Part B. If at that time you're already have health insurance from current work, then you can just refuse Part B, return the card, and there's instructions in the packet on how to do that. If you're not receiving benefits, then you manually have to go ahead and sign up for Part A and Part B, and then you find a plan that is going to cover all the gaps. And I'll put up the chapter logo here in a little bit. Those are the ones my son and I have partnered with to help you all out to find a Medicare supplement plan, a Medicare Advantage plan, Part D, and all the rest of it. Okay, so that is it in a nutshell for Medicare. If one of the other things, if you're on disability and you turn 65, that's an important year as well. Why is that? In most states, if you're receiving SSDI, Social Security Disability Insurance, and you're eligible for Medicare, basically the only supplement thing you can get is a Medicare Advantage plan. And maybe you wanted a Medicare supplement plan, one of those Plan N or Plan G or whatever. But in your state, they didn't offer that to you. When you turn 65, they can't refuse you. They can't ask you any health questions. They can't charge you any extra because you're in your golden opportunity, 65 years old. So if you're on Social Security Disability and you're approaching the 65th birthday, reach out and see if a Medicare supplement plan is better than what you currently have, because that might be your only opportunity. Okay, so let's move on to Social Security itself. When you turn after 65, you can still work. If you are receiving Social Security benefits, number one, you can still work and receive Social Security benefits. You just have to stay under the annual earnings limit. For this year, in 2025, it's $23,400. Anything over $23,400 that you earn, Social Security holds back $1 for every $2 you go over, okay? The year you turn your full retirement age, all of that kind of switches. The year, so if you turn your full retirement age this year, let's say October 2025, it's not the $23,400, it switches to $62,160, and they only care about the months before your full retirement age. So from January until September, you can make $62,160. Anything over that, Social Security holds back $1 for every $3 you go over. And then in October, because that's your full retirement age, whenever you hit your full retirement age, you can, as I always say, you can go back to making $1 billion a month, and Social Security doesn't care anymore. Okay, so that you can work. And some people file for their Social Security benefits and then, start their retirement. I think they're going to love retirement. And like me, after about a week, I got super, super bored and started doing this crazy thing. Sometimes people say, well, I shouldn't have done that. I've got another job, or my boss wanted me back and decided to pay me a whole bunch more money, whatever the case may be. They change their mind. No problem whatsoever. Social Security, yeah, there's set up to help you do that. And there's a few ways they can help you do that. One is within 12 months. If you file for Social Security benefits, you start getting your Social Security benefits, and within 12 months, you change your mind, you just call up Social Security and say, I've changed my mind. I want to withdraw my application. So you withdraw the application officially, and then they tell you how much they paid you, and you have to pay that money back, because you're basically withdrawing your application like it never happened. So if it never happened, you should have never got that money for that 1, 2, 3, 4, 12 months, whatever the case may be. So those are two steps. One is you have to withdraw the application, and number two, you have to pay it back. And until the check clears, you're still on the hook. So once the check clears, then it's done. It's like it never happened. And then a year later, I've had people, they withdraw the application, and then a month later, they file again. You can do that. But you can file again in the future with no problem whatsoever. So that's one way to kind of get a mulligan if you want to change your mind. Another way is if you're, making $23,400 and all of a sudden you find another job that makes a lot more money, just call Social Security and say, hey, because remember, $1 for every $2 you go over, and say, hey, my income for this year is going to be $80,000, and they will suspend your benefits for however many months you're over that. Okay. And will you ever get that money back? Kind of. Once you hit your full retirement age, so let's say they withhold your benefits for 10 months. And your monthly benefit is $2,000 a month. So that's $20,000 they withheld, because $1 for every $2. And when you hit your full retirement age, they're not going to give you a check for $20,000. Now that you're not going to get it back like that. What they do is they unreduce. It's called the ARF, adjusted reduction factor. Basically, once you hit your full retirement age, they see how many actual months of benefits you got, and then they adjust it. So let's say you get your benefits 30 months early. So your benefits are reduced by 30 months. And then after 10 months, you go back to work. And so basically you only got 10 months worth of checks. So once you hit your full retirement age and you restart your benefits, Social Security is not going to give you a 30-month reduction check. They're going to look at it and says, hey, this person only received 10 months, or we're only going to reduce it by 10 months. And so for the rest of your life, you're only going to be reduced by 10 months. And that's 100% automatic once you restart your benefits at your full retirement age. Okay. And then there's one other way to suspend your benefits. A lot of people don't know about this. A lot of Social Security employees don't know about this because not a lot of people do it. It's called voluntary delayed retirement credits. A few months before you hit your full retirement age, you can actually suspend your benefits just before your full retirement age. And that way you can get those delayed retirement credits. Delayed retirement credits are credits you get 8% per year that are applied to your benefit amount based on you waiting. So if you wait 3 years, so if your full retirement age is 67 and you wait till 70, then you're going to get 24% added on to how much your benefit is. So if let's say your benefit is $1,000 at full retirement age, if you wait until 70, your monthly benefit is going to be $1,240. Okay. All right. So, and then there's another thing that a lot of people miss when they start their benefits. And let me go ahead and throw up my website. I've got calculators here, mygovexpert.com for all the new people out there. I say it's the best Social Security website on the internet, better than SSA.gov, because mine is actually written in understandable English, and it's got a bunch of free calculators there, and all the rest of it. So if you want to know when your full retirement age, exactly what month and what year your full retirement age, you click there. If you want to look at the working and benefits, it's got a calculator there for a free calculator. They've got when do you want to start your benefits? I've got a calculator there that kind of helps you figure out when you want to start your benefits. But let's click on the working and benefits here. There's a lot of people that makes mistakes, particularly this time of the year. We're approaching the end of the year. And people say, yeah, I'd really like to start my Social Security benefits next month, but I've already made over the $23,400 for this year. So I guess I have to wait till January. Wrong. The first year you start your retirement benefits, there is what's called the annual versus the monthly. The first year you start your Social Security benefits, Social Security can use a monthly test, okay? And the monthly test is basically, okay, here it is, August. You are going to stop working in September. But sure, you've already made $1 billion up until now. Social Security don't care. Social Security only cares about, okay, when you start your monthly Social Security benefits, how much are you going to make every month? And you'll say, well, starting next month, I'm not going to work at all. And they say, okay, as long as you stay under the monthly limit. For this year, it's $1,950. As long as you stay under that monthly limit, we can start your benefits in September. You just have to stay under that monthly limit, $19.50 for September, October, November, December for the rest of the year. And then next year, you can't do the monthly limit twice. You can only do it one time, the first year. Next year, you have to stay under the yearly limit, whatever it is going to be next year, probably $24,000, $25,000. So there's a lot of people that want to start their benefits early, but think, hey, I made too much money and therefore I can't start this year. I have to wait till January. That's why Social Security, I've done this a million times, taken hundreds of thousands of claims, and the busy season is usually November, December, January, where people want to start their benefits in the new year. And then invariably half of those people, they say, yeah, I had to wait till January because I made too much last year. And I'm like, no, you could have started benefits in July, August, and tell them about the monthly. And oh my gosh, I should have started benefits then. And so a lot of people make that mistake. Okay. All right. And then in terms of the annual earnings limit, the monthly earnings limit, once you hit your full retirement age, doesn't matter anymore. You can go back to making $1 billion a month and Social Security doesn't care. But they will increase your benefit amount because your benefit amount is based on your high 35 years of earnings. It's not on your last year of earning or last 3 or last 5. A lot of people think that. It's based on your high 35 years of earnings, whatever high, based on, they also index that for like a wage inflation. So you could, maybe that $20,000 you made when you were 20 years old, worth $80,000 today, and that's one of your high years. So they base it on your high 35 years. If you continue to work even after you start collecting your Social Security benefits, number one, you're still going to pay FICA. You're still going to pay into Social Security. But if that's one of your high 35 years, then your benefits are just going to increase. Because what happens is once Social Security gets word from your employer or the IRS or whoever, and they see this is Bella or Abby or Nina or Katrina, all the people who've got questions here, Felicia, if you worked last year and then the IRS, your employer, tells Social Security, and that's one of your high years, Social Security will take out one of those low 35, the lowest 35, kick that one out, stick in the new one, recalculate, and your benefits will go up. And that's 100% automatic. You don't have to do anything. But it does take a while. It does take a while. COLA increases happen immediately, January. But in terms of the increase because you're one of your high 35 years, I just got a message yesterday that someone just got some extra money in their Social Security check and they want to know what it was for. And I told them, well, it's August. Sometimes that's what it's for. It was like another $35 or something like that. And I said, well, that's probably it. Did you work last year? Yes, I worked last year. Did you make pretty good money last year? Yeah, that's it. So they readjust. And what happens at Social Security is once they do that, once someone on the other side or the computer makes that calculation and determines that your benefits are going to go up or they make some type of change to your benefit amount, they push the button, they adjudicate it. The direct deposit is super, super quick. It immediately goes to your bank account. And at the same time they push the button, they send that information to the paper printing office so you can get your letter. So usually the letter explaining it comes about a week after you get it in your direct deposit. So people always kind of freak out. Oh, I just got an extra $100, $200. Well, what was it for? And I said, well, it's probably for this, but you'll receive a letter in about 4 or 5 days and it'll tell you. Or if you signed up, which I always recommend everybody does, go into SSA.gov, sign up for that My Social Security account, and then you can go in there and usually it has it in there why your benefit changed or you're in suspense or whatever the case may be. Okay. And there's always tons of different questions. And all of these apply for Social Security. When we talk about retirement in terms of working and all that, the monthly and the annual earnings limit, we're talking about retirement benefits, which include spouse benefits. Those are considered retirement benefits. You're getting those spouse benefits based on retirement. So those work limitations also apply when you're receiving spouse benefits. Those work limitations also apply when we're talking about divorce spouse benefits. Those work limitations also apply surviving spouse benefits, because you have to be at least 60 years old to collect surviving spouse benefits. So it's kind of a retirement type of benefits. Disability is different. You can get disability at any year, but the work limitations for disability are a completely different animal. And on my website, I've got all the details on that. Okay. So I think I went down the list fairly quickly, but there's always tons of questions people have on follow-ups. So let's get into some of those questions now. Money Moves Tony. When you claim Social Security benefits, why does it take 30 days to get the final approval? Yeah, 30 days is, it's taking some people a lot longer than that. It also depends when you file, when your month of entitlement is. If you're choosing a future month of entitlement, sometimes you won't get the letter till later because when they push the button, the computer system won't activate until the current operating month. So the claim specialist will push the button, and then the computer won't do anything until essentially that month. So yeah, but everything's taking longer because Doge and Elon Musk decided to fire a whole bunch of people. And so Social Security just doesn't have any staff. And that's been, unfortunately, the reality for a long time. 50 years is, Social Security is a 50-year low in terms of staffing. So we need to demand better. If I married again after my first husband died, can I draw off my new husband if we were both 80 years of age and only married 4 years? Okay, so you can only draw off of one. So you married again after my first, so you can continue to receive benefits on your deceased husband if that's more, but if your new husband and only married 4, so you remarried after 60 years old, so your survivor benefits are going to continue, no issue there. But if your new husband benefit amount is higher, then definitely jump on that one. Absolutely. But it really depends on how much each person, earned throughout their life. But normally it's better to stay on a surviving spouse account record, because that one you get up to 100% of the benefit amount. If you're receiving spouse benefits or divorce spouse benefits and that person is still out there alive and kicking, you only get up to 50%. So even though your current husband's benefit amount is higher, you only get up to 50% of that. Well, in your case, you will get 50% because you're past your full retirement age. But yeah, I would call up and say, hey, is there more money on my current husband? And if it is, then file that application. And then you'll be taken off the surviving spouse, and you'll just be taken, just getting spouse benefits off of the current husband. But up to 50%. And same type of situation, if something happens to him, then you'll get up to 100% of that benefit amount. So, why are Social Security checks paid in the rear? Paid in the arrears. Is because inevitably we all shuffle off our mortal coil and kick the bucket, all the rest of it. And Social Security does that so they can catch it at the end, because we all will have an end, or a rear, I guess. Anyway, so you have to be alive the entire month to be entitled to that benefit amount. So if you're alive the entire month, you get the following month. But if not, then Social Security needs a little time to go ahead and go in there and grab that check out of there. So yeah, that's essentially why they do that. I'm currently on widow's benefits. I am going to work part-time the rest of the year. Will my Social Security on my account go up? I do plan to switch at full retirement age of 70. Okay. So you're on current widow's benefits. So you're going to work part-time, but working part-time will not affect your benefits now because you're working on your own record. So it obviously doesn't affect widow's benefits. Your widow's benefit check is going to stay the same. Obviously, COLA will increase and stuff, but your widow's benefits are not going to change based on your work. But your Social Security, yeah, if that's one of the high 35 years, if you work this year and that's one of your high 35 years, then yes, your benefit amount will go up. And you are doing everything correctly. It sounds like mom to huskies. You did the smart thing. Well, it depends on the numbers, but it sounds like you did. You are collecting widow's benefits, surviving spouse benefits, widow benefits. They're all the same, basically. And you didn't touch your benefits on your own record. And then what you're doing is letting your benefits on your own record continue to increase. And if they're more at 67, you can jump over there. But if you want to wait and get even more at 68, you wait till 68 or 69 or 70, but you're waiting till 70. Remember, they don't stop increasing based on waiting to get them after the month you turn 70. So make sure you start those, you switch over to your own account at the month of 70, okay? The month you turn 70. And then you'll probably receive, if your local Social Security office is doing the right thing and they have enough staff to do the right thing, you'll probably get a letter, every now and then, once a year, and it says, hey, by the way, you're getting spouse benefits and or surviving spouse benefits, and your benefits are, let's say, $2,000, and we just noticed that your benefits on your own record is more. You can come in and get the extra money if you want. You have to file an application. It's called a WIB-RIB letter. But if you get that letter, you just say, yeah, I know, I'm waiting until 70. So you don't have to contact him if you don't want to. Thank you, Ramon Phelps. Thank you very much. I appreciate it. If they take out money for their Medicare insurance that I don't want them, where do I find money to live on since I'm unable to stand for very long? Okay, so if you're having a hard time paying for that $185, the Medicaid, and Medicaid is going to be losing about $1 trillion, $100 billion a year. So they're going to be in dire straits in every state. They're already on the borderline. But if you're having a hard time paying for Part B, the $185, please contact your state Medicaid office. And they're called different things in different areas: Sooner Care, or Denali Care, or whatever, Medi-Cal in California. So whatever your particular state calls Medicaid, call them and say, hey, I'm having a hard time paying that $185. I just don't have enough money every month to pay for that and pay for rent and everything. And they will take an application for Medicaid. And if they approve you, at the higher levels, then they will pay for your Part B premium, that $185. And that's a beautiful thing. And they'll probably also sign you up for that Medicare Part D, the extra help with the prescription drug plan. And then if you get the higher levels of Medicaid and you have Medicare as well, you're also eligible for those Medicare Advantage dual eligible plans. Usually I always recommend checking out Medicare supplement plans, but if you have Medicaid, all you can get is a Medicare Advantage plan. So you get, somebody said in Tennessee, they're called TennCare. Yes. So if you have the higher levels of Medicaid and Medicare, you get the $185 paid for, and then you're also eligible for a Medicare Advantage dual eligible plan. And those are the ones that you see advertised all the time with all the, all the bells and whistles, and the grocery cards. Those grocery cards do exist. The way they advertise them is really, really scammy. So some of these people out there, but they do exist. But it really depends on what type of Medicaid you have, where you live, what's available in your area, and all the rest of it. So reach out to Chapter if you want, and they can definitely help you out, see what's available in your area. Thailand with Monchai. Can you apply for retirement benefits 6 months before the eligibility date, since Social Security caseworkers are overloaded with applicants? Maybe 6 months early. No. Because you can only do it about 3, maybe 4 months before your eligibility date, because the system, the computer system, the MCS, modernized claim system, I don't know why they call it modernized. It's anyway, it won't allow an application that early. And so, yeah, and you wouldn't want to do it anyway. We've had very, very extenuating circumstances where people are like, well, I'm leaving the country, yada, yada, yada. Can you take it, 5 months in advance? And what happens is the claim specialist has to actually put that on their desk. They can't put it in the system necessarily. They have to kind of put it on their desk and hope that person doesn't get sick or get fired by Doge or whatever the case may be. Because if they do, then yeah, you're up the creek. So no, you can only do it about 3 or 4 months ahead of the game. So, and then contact your politicians and say, hey, we shouldn't have to be waiting 6 months and all the rest of it. So, I'm a widow. I will be 63 in October. I haven't applied for surviving spouse benefits. Um, so if you're working and making over the annual earnings limit, the 23,400, substantially over that, then maybe you made the right decision. If not, and you need that money, yeah, you should definitely apply. Remember, widow's benefits, surviving spouse benefits, widower benefits, you can get those as early as 60 years old. Okay. So, all right. If I retire at 60, how will my Social Security be figured when I reach 62? Well, if you retire at 60, if you start your Social Security benefits at 60, then that means you're receiving surviving spouse benefits. That's the only thing you can receive at 60 is surviving spouse benefits. But yeah, so it'll be just calculated. I did a video a 3 days ago on how Social Security benefits are actually calculated. I got into the weeds and did the PIA and the AMI and the bend points and all that other kind of stuff. So you can definitely check out that video I did 3 days ago. Bills paid and the Cowardly Lions there. I am currently in my 70s and I'm married. My ex-wife of 20 years just passed, unfortunately. Wow. And her present husband is now getting her higher Social Security. Can I also get a bump up? Yeah, one X doesn't affect the other X at all. So it really depends on your benefit amount and what her benefit amount was. So I would definitely contact Social Security and say, hey, based on your benefit amount, based on her benefit amount, the PIA, the primary insurance amount, they'll look at those two numbers. And if your benefit amount is lower, not your check, because you might have taken it early or, whatever the case, they look at the primary insurance amount. And they will tell whether you're entitled to any other benefits off her record. But at the very, very least, you'll be able to get that very embarrassing $255, the lump sum death benefit. So I know it's no consolation, but it is there for you. So Sammy, diagnosed with Meniere's disease 3.5 years ago. My employer was very understanding, but I have gotten worse. I have had the same job for 34 years and turning 62. Can I file for SS and SSDI? Absolutely. It's called a rib dip. Yeah, Meniere's disease. My wife had that, and it's just you get discombobulated and want to fall over all the time and get dizzy. And okay, so it's called rib dip. So you can file for your retirement benefits and file for your disability benefits at the same time. You won't get both, but here's why people do that. Is because you file for disability benefits and it takes, someone says it takes a month to file for retirement. Well, it takes months and months and months to get a decision on your disability claim. It's completely unsatisfactory. But it takes months and months and months to get a decision on your disability claim. And if you're denied, then you have to file an appeal. And then we're talking 1 or 2 years, and it's crazy. It's completely unsatisfactory. So in the meantime, people need to pay the rent. So you file for your disability benefits, you're waiting for a decision, and you're like, but I need money now. So that's why you file for retirement benefits at that time. So you go ahead and file for retirement benefits, and you get that monthly check while you're waiting for your disability decision. So that is one thing I would definitely check out. So let's see. I thought if you were remarried for a certain amount of time, you did not get your spouse's social. It really depends on what we're talking about here. If we're talking about survivor benefits, other benefits, there's a lot of, exceptions to the exceptions about that. $6,000 deductible affect earnings limit, 23,000 or having nothing to do with it. Yeah, that's the $6,000 deduction. The president promised no taxes on Social Security. Yeah, it didn't work out that way. The consolation prize was the $6,000 deduction, or $12,000 if you're married. But about half of people, neither of those would help half of the people out there anyway, the people that really need it, because they don't pay taxes on their Social Security anyway. So none of that would have helped. It would actually have hurt, because it would hurt the Social Security Trust Fund, and then we would get cuts even sooner. Right now, we are, for all the new people out there that are just watching, you're going to get a cut. 89 more checks, 89 more full checks. You're going to continue to get your check full amount for 89 more checks. And then you're going to get a 23% cut as things stand right now if we don't do anything, because our politicians have failed us for 40 years and not done anything. Yeah, so there's that. And let me show a little video of the commissioner of Social Security. He just he was on there with President Trump. I did a video on this yesterday about the 90th anniversary of Social Security, and I'm also going to do one probably tomorrow because I fact-checked President Trump's comments on Social Security yesterday. I think it was yesterday. Yes, yesterday. And so tomorrow I'm going to fact check Bernie Sanders' comments on Social Security at the 90th anniversary. So stay tuned for that. So let's listen to what the commissioner says and this Fox Business commentator.
There's a lot of talk about insolvency. And it's a fair, I mean, it's of the three things that drag down spending in this country, Social Security is one of them. At the same time, why not just raise the Social Security age? If you look at the
Social Security does not drag down anything. Social Security, okay, calm, Ed. Social Security is completely separately funded by FICA taxes. It's a completely separate thing. It has nothing to do with the debt. It does not add one penny to the $36 trillion of debt we have. Social Security, this is a Fox Business person. You figure she knows business, she knows the economy, but she does. She knows. She knows it doesn't. But anyway, and now her solution is not to make people like her and him and JP Morgan Chase, Jamie Dimon guy, which they're going to talk about here in a second, pay the same amount we do. It's about, hey, you know, those people that really need the money, let's rob it from them as long as we possibly can.
Age projections. So here are the numbers. Let me give you the law was signed in 1935, right? For men, the average lifespan 59.9 years. For women, it was 63.9. Well, now it's 75.8 years for men, 81.1 years for women. So we're living longer. Why not to spare the program, to save it, to help work out the kinks, which is going to take years, just up the age?
So I think, first of all, August 14th.
All right, just up the age. So they tried to do that earlier this year. There was kind of a midnight attempt to raise the retirement age. Luckily, that didn't go through. And this is, you know, the fallback. You know, if you're, you know, white collar like these people, you don't need Social Security. You don't care. You don't care. You can work longer, no problem. But you know, my dad was a long distance truck driver. You can't work till 69 and 70. I know there's long distance truck drivers doing it, but that's tough. That's tough on your body. Manual work like that, you just can't do it till 70 years. And she said that it's like the average age, you live till 75 years old, men. So they're, they work all their life, 50, 60 years, and they're only going to get 5 years of Social Security. That's what you're arguing, lady? Unbelievable.
Is the 90th
Tone deaf
anniversary of Social Security. And the president has been very clear, and I'm working under that mandate that we're going to protect and preserve it. And yes, part of working on fraud, waste, abuse, and efficiency is protecting and preserving it. The 4 trustees, myself, Department of Labor, Department of Health and Human Services, and Treasury Secretary are the trustees. We will work with Congress. It will get fixed. There'll be another 90 years of it.
So that's a conversation that's happening.
Yes, it has to happen. We just released the trustee report. Okay. We will continue improving everything we're doing, and we begin the dialogue directed by the White House to protect and preserve for the rest of time. This president's delivered on every commitment he said, and protecting and preserving Social Security will be one of them.
We have to run, sir, but just real quick, you used to work for Jamie Dimon at JP Morgan Chase. You were COO. You ever call him up for advice on your new post?
No, but I talked to him before I came here, and he's a great friend and a great leader.
He's good with the numbers.
Yeah.
He might be a good someone to consult with.
Okay, yeah. So this is the first time in a long, long, long time that we've had somebody from Wall Street and somebody from Wall Street that's also calling up before he, the Social Security Commissioner. Sounds like he calls up JP Morgan Chase and, on a daily basis, it sounds like, and consult with him. Hey, I'm going on. What should I say about Social Security? Yeah, it's kind of strange there. Well, it's not strange that Wall Street has been chomping at the bit for decades to try to get a hold of the Social Security Trust Fund, that $2.6 trillion in the trust fund, and the 1.2, $1.3 trillion that comes in every year from FICA taxes. They have wanted that money so they can gamble on Wall Street with that forever and make their massive commissions. So this is a long time effort to privatize Social Security and get all their commissions. And he says, "Oh yeah, we're going to work with the president and Congress and the trustees. We're going to come up with a plan." And I think I got a cricket button here that I can't figure out how to play the cricket button, but we've seen zero plan. Well, actually, there's a plan that's been around for a while, and I'm going to fact check that plan tomorrow. Bernie Sanders has a brand new plan. It's kind of like his old plan, but he's bringing it up again. And he's been bringing it up for decades to try to save Social Security. So I'll do a fact check on. He missed some stuff, but I'll talk about that tomorrow. So, if the government is collecting all this tariff money, why don't they pay the money they took out of Social Security? Well, number one, they did. That's a internet myth. The money wasn't taken out of Social Security. If you read the Social Security trustees report, the money is still there. It is in treasury bonds. The 2024, the Social Security trustees came out, with all the calculations. Right now, as of 2023, there was 2.6 trillion. They paid a bunch of benefits, and then $103 billion of the benefits, and now they're down to $2.5 trillion in the Social Security Trust Fund. So that's, the money wasn't stolen, it's there. So number one. And tariff money is basically just a tax on us, all right? American importers pay that import tax, and then they pass it down to us. It hasn't trickled down to us. That's one thing that's the one thing about trickle down in economics that actually does trickle down to us. Giving more money to the rich people, that really hasn't trickled down to us. But when importers pay more, Walmart or Target or whoever pays more for stuff, yeah, they're definitely going to be trickling that down to us. So I guess that's one part of trickle down economics. That is reality. Will my Social Security be taken away if I move to Mexico? I can't afford to live in the United States. If you're an American citizen or legal, particularly if you're an American citizen, yeah, you can live anywhere in the world, no issues whatsoever, except for North Korea or Cuba. So if you were looking to avoid enjoy the beautiful beaches of North Korea, sorry. If married 10 years, can either spouse draw Social Security from each other's divorced? Yes. If you were married, let's say 3 times for 10 years, then when you file for Social Security, that's what the Social Security employee does. They say, were you married for 10 years along to anybody? You say, yeah, I was married 3 times. They will look at each one of those records and see which one is the most money for you. Yep. And one doesn't affect the other. So if your ex got remarried and they have a new spouse and new kids, whatever, that doesn't affect them whatsoever. So let's see. It's too hard for me to listen to these lies. Bless you, Ed, for keeping up with everything. You're welcome. I appreciate it. Yeah, it's a daily battle. We're coming up with a new community project that we need everybody to participate in. That we're going to try to move the needle on this, on Social Security, Medicare, Medicaid, disability, continuing disability reviews, all the rest of it. We're going to try to help as many people out there because there is strength in numbers, and we are going to put our numbers together in a cohesive fashion and try to get something done. So I'm working on that right now. Hopefully the next few weeks we'll have it rolled out. So why not do what Australia does? If you're wealthy, you cannot collect Social Security. It's for the poor. Well, Social Security does kind of do that. They're called bin points. and I talked about this a few days ago when I did the calculations. If you are receiving Social Security benefits and you worked more throughout your life, you receive a lot less as a replacement rate. So if your average earnings throughout your life was only $1,000 a month, you're going to get 90% replaced on a monthly basis. So your check is going to be about $900. If you made $10,000 on average throughout your life, then you're only going to get about a 35% replacement rate. So it's progressive. So people always say, well, if you raise the FICA cap and more, rich people pay, like the rest of us, then they'll just get more money and it's going to defeat the purpose. No, those people just don't know about bin points. There's bin points and 90%, 32%, 15%. And all we would have to do is add another bin point, 0.00000 or 0.00001% or something for the fourth bin point. And then maybe name a dog park after you or something like that for the, anyway. So I am 59 and had multiple strokes. So I applied for disability benefits, got it after 2 years. Oh, that's way, way too long, isn't it? So you probably went to the administrative law judge. You applied, you were denied, you filed the appeal, the request for reconsideration. Good on you. You were probably denied at the second level, and then you went to the third level. Good on you that you fought for it. And then the administrative law judge agreed with you. Remember, people often miss that when they're approved at, let's say, the third level after a couple years, and the judge says, yeah, no, Social Security made a wrong decision. You should have been approved day one. That means your benefit started 2 years ago. And a lot of people don't realize that, and they mess up their medical insurance. Because if you're on disability for 2 years, even if you're approved yesterday and they backdate it 2 years, that means you're on disability for 2 years, and therefore you're eligible for Medicare after being on disability for 2 years. So, all right, I've got some video questions. Let's watch some of those.
I want to thank you first for answering this for me. I have Medicare and Medicaid, and Q&B is paid for me, so I don't have to pay that. But what I'm wondering is why on Medicaid do I have a spend down of $175 every month? If I can't afford the Part B, how can I afford the Medicaid 175 spend down? And I have to keep the Medicaid to keep my Advantage plan. And I don't know how I'm doing that because I'm not paying the spend down because I can't afford it. I have a house payment of over $850 and plus my other bills, so there's no way. And is it possible I can get on SSI to help with these bills? Please, if you could answer this, I sure would appreciate it because I need any help I can get right now. And thank you for helping everyone.
Okay, so spin down. Yeah, a spin down is normally if you're receiving SSI, which is the Supplemental Security Income, the welfare-based program Social Security administers, or if you're receiving Medicaid or food stamps, any type of needs-based program, and you get some type of money coming in, like an inheritance, you win the lottery or something like that. If it's just a relatively small amount, what you can do is you can spend it down. It's like, oh, I just won, $2,000 on the slot machine. I put a quarter in, made $2,000, and they say, well, you're going to be kicked off of Medicaid or SSI because of that. And all you have to do is, okay, I'm going to spend that down because I got $2,000, but I need to fix my car and I need to fix my air conditioner. I've got some debts to pay off and stuff like that. So that's called a spin down. So I think what you're talking about is possibly, hopefully I'm not wrong, you've got some kind of co-pays type thing that your particular state is kind of cheap, it sounds like, and they're paying for your $185 Part B premium, but they're also saying that you have to pay $175 out of pocket just to stay into the program, and we're going to see that a lot more, unfortunately, because of the big beautiful bill. Congress and our politicians in Washington have decided that poor people need to, pony up a lot more money because, they have it, so we can give it to the rich anyway. And that's going to happen a lot more in the future. States are going to have a hard time keeping people on Medicaid, so they're going to be doing stuff like this quite often. So in that particular case, I would reach out to the state. That sounds like it's a state policy. That's not necessarily a national. So each state is a little bit different in how they administer Medicaid. And I would ask them about that. I would fight that. I'd say, wait a second here. You're saying that, you're giving me the higher levels of Medicaid, the QMB. Awesome, beautiful. I appreciate that. Qualified Medicare beneficiary. You're paying my $185 because I can't afford the $185. But at the same time, you're telling me to also pay $175 out of my own pocket to keep, that just doesn't make sense, logical sense, right? So I would definitely fight that. File an appeal or request for reconsideration in your particular state. And as for SSI, SSI, the max you can get out of SSI is $967. So if your benefit amount, whatever Social Security or survivor benefits benefit amount is over $967, then you would not qualify for SSI. But if your benefits are under $967, I would definitely, and you have no other income and no other pensions or working or something like that, I would definitely contact Social Security and apply for SSI and maybe get you some more money. So if let's say you're getting $500 from your retirement from Social Security, and then you apply for SSI, then you'll get another $467 for a total of $967. So that's how that works. And then hopefully they're also putting you on the extra help with prescription drug plan, the Part D plan, where they're helping with your prescription drugs. So hopefully you're able to save some money there as well. And then watch my video on my description. You'll see a video there that says living on Social Security alone. And I go through about 50 different programs that might help you out. So make sure you watch that video and grab a piece of paper and a pen and say, okay, this one might make my life a little bit easier. And it's in my description of this video. All my videos, I put it down there. It's living on Social Security alone. I've done 3 or 4 versions of that video. So make sure you check that out. All right, let's see what other kind of question we have here.
Hi, Dr. Ed. I'm wondering, I started collecting on my ex-husband's Social Security before I was 67. I get like $300 and something a month now. And I'm just wondering, he has not retired yet. They told me that I would automatically get half once he retires, and I'm not sure about what that even means. So if you give me any information at all on, it's probably too late now, but should I expect to get half of his Social Security when he does retire?
Okay, so it sounds like you're already getting benefits on his record because you said you're getting about 360 or so. So yeah, those benefits won't go up when he retires. You filed, it sounds like you're very smart and you did what a lot of people didn't do. You filed for what's called independently entitled divorced spouse benefits. So you were receiving benefits on your record and you had a spouse, a previous spouse that you were married to for 10 years, and that person was at least 62 years old. Doesn't matter if they have filed for benefits on their own record. Doesn't matter. You did the right thing and you filed for that independently entitled divorced spouse benefits. He hasn't started his benefits, doesn't matter. You were married to him for 10 years. You were divorced for 2 years. That's the divorce for 2 years is the independently entitled divorced spouse benefit is the only one that matters. And then you're collecting those benefits. So when he retires, it won't affect your benefits at all. The only thing that will is, if he continues to work and pay into Social Security, and that's one of his high years, then your benefit will increase as his benefit will increase. One thing that will change, because you're receiving up to 50%. The reason you're not receiving exactly 50% is because you filed benefits early. So anytime you take Social Security benefits early, they reduce it by however many months you took it early. The one thing that will change is when he leaves us here, your benefits will automatically switch from spouse benefits to surviving spouse benefits. Spouse benefits, you get up to 50%. Surviving spouse benefits, you get up to 100%. So I've got people all the time that said, hey, I just looked at my bank account and my check is doubled from last month. And I'm like, well, were you receiving spouse benefits? Yeah. Are you in touch of your ex-spouse? No, I never want to talk to that person again. Well, I hate to break the news to you. That person has passed away. And wherever in the country or the world that person passed away, Social Security was notified and your benefit amount was automatically switched from spouse benefits to surviving benefits. And that's usually 100% automatic. So, all right, let's see. Got a few more questions here.
Hi there. My name's Rhonda and I live in Ohio. And I wanted to share that I have had to call Social Security recently here. I had to call them 3 times. And the first 2 times I waited 2 hours. And the last time I waited 4 hours. And it's a good thing I'm patient, you know, but it's ridiculous. That was way too long. Just wanted to share that with you.
Thank you. Appreciate
Hi
it.
there.
Yes. Yeah, the commissioner and the president yesterday on that was talking about, oh, the phones are so much better and stuff like that. They're so much better than they was last year. Well, that's because they added AI, and they also said, oh, we're getting twice as many calls now. I was, yeah, of course you're getting twice as many calls. People are calling once and they're thinking they're going to get a human being, and they're talking to the stupid AI. I've called a bunch of times to see what the AI says, and it just puts you in circles, and you just get fed up and you hang up and then you call again. Yes, that's why people are they're getting twice as many calls, is because people are getting frustrated and having to call back. And what's, and this has been going on for a while, unfortunately. It's not only with the current president, although because of AI and, firing, moving, they technically didn't fire. It's, as we used to say in the Marine Corps, it's voluntold. You were told to volunteer to get the heck out of the premises, get out of the building. And this has been going on for a long time. Social Security staffing has, even before DOGE and the current administration came in, they were at a 50-year low in terms of staffing. And these are the people that are supposed to pick up the phones and help you file for disability and survivor benefits. But Congress refuses to give Social Security the resources you gave when you paid those FICA taxes. That's what's messed up, is all those decades you paid FICA taxes, a very, very small percentage of that, like 1%, goes to help you get those benefits. And Congress refuses to give those resources to Social Security so they can help you. And that's one of the reasons I came out of retirement and are doing these crazy videos. So it's completely unacceptable, and we need to do something about it. So, all right, another question here.
Hi, Dr. Ed. Russo from Chicago again. Just have a question regarding people that move out of the country. How do they have to prove that they're alive? It just seems like there's big areas of people can scheme things and continue to reset benefits after their spouse has died or something. I mean, how do they prove that they're alive? By simply filling out a piece of paper or making a phone call? If you can just touch on that, it would be.
Yeah, so every year, all those people that live overseas, the expats overseas, know exactly. It's a pain in the butt, but they have to do it. And they receive a letter from Social Security, and they have to return that within a certain amount of days. And if they don't, their benefits are automatically suspended. And yeah, a lot of people, they move around or they don't get the mail, and then all of a sudden they lose their benefits for a month or 2 months or 3 months until they get it all started up. But yeah, Social Security has a system to do that. And another question here, she was playing my video the entire time, so it's hard to hear her. So I might just, do a short one on this one. Okay. All right. So she's on Social Security disability insurance, and then did I play that? When she gets her question about Social Security disability insurance, she's under her full retirement age, and she is seeing if she can work. Yes, if you're on disability benefits, and here's what a lot of people miss. Everybody, if you're on disability benefits, everybody, Congress, the president, people at Social Security, they all want you to see if you can work. If you're able to work, and because you're going to make more money probably working, and you're going to get out of the house, it's usually better for you. You pay taxes. You no longer have to, pull money out of the Social Security Disability Trust Fund. So it's good for everybody. So Congress realized that for decades, and so they make a bunch of work incentives to help you go back to work. But they are extremely difficult to navigate. And so that's why on my website, if you you click on Social Security, click on disability, it has working and benefits. And I've got a PDF guide there that tells you about working. I've got a calculator there. And that's one of the things we get a lot of calls about fraud. People say, hey, I've got this person that is receiving disability benefits, but they work, and so they're a fraud. And we used to investigate those all the time. And, 70% it was just, yes, they are allowed to work a certain amount. It's called SGA this year. That's $1,620. So they can make up to $1,620 and still get disability benefits. For the first 9 months, they have a trial work period where they can work as much as they want to see if they're able to work and go back to work. So Congress has made a lot of laws and regulations that said, hey, if you're on disability, we'd like for you to get off disability. If you're able to do it, go for it. And here's a bunch of incentives that we have started. But she had also asked, okay, once I reach my full retirement age, what happens? Well, once you reach your full retirement age, you're no longer on disability. Nobody in the country is receiving Social Security disability after their full retirement age. Everybody is switched over to regular retirement benefits. And because you're on regular retirement benefits, no more work limitations, no more continuing disability reviews. You're free. You can do whatever you want. So, and a lot of people are losing money that I get people here all the time asking live, I'm 70 years old and I'm on disability, and I got offered a job, but I had to decline it because I didn't want to get my disability benefits cut off. I'm like, no, take the job. If you wanted the job, call that person up immediately and take that job, because you're not on disability. You're on regular retirement, and you're after your full retirement age, and you can make $1 billion a month, and it doesn't affect your benefits whatsoever. Might actually increase your benefit amount. So, let's share that information with everybody so they can, a lot of people out there are suffering. So please share, subscribe, like, all that kind of good stuff so people get this information. Okay. I think we went through everything today, and we're at an hour. So we made it again, and I'll be back again tomorrow, and we will fact check Bernie Sanders on his comments on the 90th anniversary of Social Security. Y'all